I just want to be appreciative of the people who are joining our panel for the last panel of the afternoon. And I'm pleased to introduce you to them and to develop out our topic of the importance of partnerships within higher education and industry leadership. So one of the premises of our Healthcare Workforce Collaborative grants was to encourage meaningful partnerships. So when we were talking to some of our higher education programs in the state of Kentucky, one of the things that came up when we asked about partnerships was, yes, we have contracts for clinical agreements or clinical affiliations and that kind of thing. You guys can come on up if you want to be seated. So we want to look at partnerships that are that exist to really collaborate with each other. These equally representative requirements. We want people to be very much engaged with these partnerships so that we can bring students both to the professional career pathway that they want to be involved in, but also to take them through to completion so that they can be successful taxpayers, they can be employed, and really benefit Kentucky. So to preserve our time today, I would like to direct you to the bios of these folks that's in your program. If you have specific interest of something that you heard them say today, please reach out to them directly and ask those questions. So we'll start today. Our first partnership is between the University of Kentucky, represented by Dr. Kathryn Cardarelli, and UK Healthcare Representative Dr. Gwen Moreland. Would the two of you provide a little bit of information with highlights about how you're working together to build the healthcare talent pool in and around Lexington?
Absolutely. Thank you, Leslie, for including us in today, and thank you to Leslie and Aaron and the team for organizing this event that I think clearly has a lot of energy and momentum. It's been a great day. So alignment of our healthcare enterprise with our academic colleges is a very high priority for our president. And part of prioritizing that was a recent leadership change that he implemented, such that our provost over our 19 deans has also recently been named co-executive vice president for health affairs. If there's a stronger sign of the priority of that alignment, I can't think of it. Our healthcare collaborative workforce grant has really allowed us to bring together our colleges of social work, nursing, medicine, and health sciences, along with our Center for Interprofessional and Community Health Education, which houses our AHEC, to work on a number of different fronts to enhance that pipeline that we've heard a lot about today, to increase our number of graduates. And one particular initiative that I have been involved with and have been very proud of is our state registered nurse aid program. And I want to give credit to our SRNA coordinator and our dean of nursing that are here today. And so in just 1 year under this grant, we've been able to graduate 240 SRNAs, which represents a 178% increase over last year. And that's all because of this grant. We've also funded some market feasibility studies recently in a number of different areas, including audiology as one example. And those are feasibility studies that happened, again, with our CPE funds, but they occurred because our colleagues in UK Healthcare specifically came to us and said, we have needs in areas A, B, and C. But lastly, one important area in which we've had a lot of success is our collaboration between our College of Nursing and UK Healthcare. And so I'm really glad that Dr. Moreland joined us today. I'll let her speak to that.
Thank you, Kathy. And thank you all for having me here today. So yes, for any nurses in the crowd, you know that if you have a great nursing tech or nursing assistant to work alongside you, that really makes your day and makes your shift. And so that partnership to increase the SRNAs was invaluable and very helpful to us, especially during the pandemic. But also, we have a very strong partnership with our College of Nursing, and that really began, years ago with our BSN residency and that transition to practice, and also with our summer nurse apprentice program, our student nurse apprentice program. But then in 2010, we really formalized that partnership, and at that time, it was 3 deans ago and a CNE ago. And they really sat down together and said, what are the needs right now? How can we partner to help one another? And at that time, that partnership really formulated around advanced practice providers. And at that time, UK Healthcare had 98 advanced practice providers, and we have well over 500 today. So it was a very strong partnership. And it was a much-needed part of our care model to help us provide the care. We could not provide the care we provide today. But that partnership has changed through the years, and we'll talk more about that with some of the questions. But at that time, that was the focus. But every year, we are looking at that and saying, what are the needs now? What do we need to be doing now? And how can we best help one another on each side of the street? So we'll talk more through the questions about some of those projects.
Thank you, Katie and Gwen, for the background on what you're doing at UK. Our next partnership is one that's a little further south in Richmond, Kentucky. Dr. Daniel Czech represents Eastern Kentucky University. He's joined by his partner, Dr. Wendy Blair, with Baptist Health Richmond. Would the two of you give us some information on what you're doing together in Richmond?
Sure.
Turn it on there. There you go.
Sure. Okay. Sure, I'd love to. But first off, I'm ecstatic to be here for numerous reasons. First, it's great to be on a panel with 2 of my sisters in crime, and that's Leslie and Mendy. They are fantastic individuals. And then second, I always like to talk about the optimal town-gown relationship that EKU has with Baptist Health Richmond. And we're going to talk about 2 programs that we have together. And the first is near and dear to my heart, because it's something that changed my life when I was in high school. Someone told me to go to the Medical Explorers meeting. They have great food. And I was going nowheres, and so sure enough, I like food, and I went to the Medical Explorers program, and I realized that this is amazing. I met wonderful leaders. They gave me vision, and here I am, a dean of a college at Eastern Kentucky University. One of the first things I did when I arrived last July is to talk about implementing the Medical Explorers Academy, which is an experience for 11th and 12th graders in Madison County to what we like to say ping pong between the academy and the hospitals. Essentially what they do for their first year, once a month they come on campus and get to meet professors from various disciplines, and they have projects that they have to do all day, and it's kind of a fun experience for them. And then also once a month they get to go to Baptist Health Richmond and learn all the different disciplines within the hospital. Their 12th grade year, then they graduate to an internship where they get to experience applied learning from a volunteer perspective at Baptist Health Richmond. And then what's really special at the end, they get to graduate from the academy as well as from high school, and then they can decide, do they want to stay in the workforce, or do they want to come to EKU and earn a bachelor's or an associate's degree? And if they do graduate from the academy, they're automatically accepted into one of our programs. It's been pretty successful thus far. I'm really excited to see this first group come through, and then each year we'll bring in about 20 students. And so hopefully we'll have a 40 group cohort go through both 11th and 12th grade years.
And I'm going to go ahead and follow what Daniel said, and I'm going to tell you, when he first came to EKU, it's just like hold on to your pants because you're talking about innovation and energy. And the minute he hit the campus, I got a call as the CNO at the hospital and said, hey, we need to meet for lunch. and we need to chat and think about the future. I've got some ideas in mind. So I think, the synergistic relationship that we've had was almost automatic. He shares an affinity with me to go ahead and create positive environments for folks so that they can learn and get into healthcare. Two things that I'll tell you, they happen because of partnerships. It's just because of our lunch that day and talking. I've got to say that Dr. Brooke Bentley, that's here today in attendance, she's the chair of the School of Nursing. She gave me a call because Madison County Schools, the Ignite program, Ignite Academy, they had literally mannequins laying on tables, if they had that, while they're teaching allied health and teaching the CNA program. And I had already reached out to Dr. Bentley and I said, you know what, we have some beds over here at the hospital and we have just turned over our beds and got new beds for our patients. Instead of sending those out for scrap metal and parts and sending those across seas, why don't we feed our own county here? So we ended up sending some of those beds out, and EKU took us up on some of those. So we put those in their skills lab and fit their skills lab with very similar beds to what we've got in the hospital. So now all of our students can go from EKU or from Ignite, and they're learning off the same equipment. And hopefully that, kind of reduces a little bit of that fear along the way. So they have some familiarity as they go from one place to the next learning, and hopefully catch them that way. The second thing I think that we've done, and EKU's been really a nice partner in that as well. We all know through research that the practice gap is still there. From the research all the way over to the transition to practice takes quite a while for that to kind of culminate and come to be. And so what we've done is we established at Baptist Richmond what's called the clinician in the classroom. And so what we have done is we've established a speaker list of experts and clinical professionals that actually the faculty can reach out to, and I did not think that was going to be that popular, but it is amazing how many calls we get on a daily basis from faculty that would like to have an expert practice person to come in and co-teach with them and offer them the practice side of the perspectives of how to do healthcare. So I think that's been a strong partnership along the way.
That was a great overview, Mendy and Daniel. So thirdly, but not lastly, way down the stage there is my friend, Dr. Patsy Jackson. She's representing Big Sandy Community and Technical College, and she brought her industry partner from Pikeville Medical Center, James Glass. So would you all tell us a little bit about what you're doing?
Sure. I think one of the things that, as far as the collaboration that we've been able to have with Big Sandy, is that we're in Pikeville, Kentucky, which is obviously a very rural community. And so as a regional hospital, we're a level 2 trauma center. We have over 500,000 patient experiences every year. And so one of the challenges that we had is those positions within the hospital that we're deficient in, and one of those is being the MLT. We don't have an MLT, or did not have an MLT program locally through Big Sandy. The closest one was in West Virginia. As I'm sure you're aware, Pikeville is right there on the border. But we didn't have an MLT program anywhere that we could tap on the shoulder. So it was not fair for us to be able to try to fill those positions within the hospital. So we reached out to, at the time, it was Dr. Telly Sellers, and reached out and said, look, what can we do in order to be able to get an MLT program here? And of course, we discussed all the options and the opportunities that might be for that, and determined that it would be it'd take a long time for us to be able to get a program accredited through the Big Sandy system. So what we did is we worked with the KCTCS system, Jefferson Technical and Community College, and through Big Sandy, we have now an MLT program. It took us about a year, but we have a satellite MLT program. So at the time that it was discussed, well, we'll let you have 6 slots. It was so successful that we now have 12 MLT positions that are being filled by the students at Big Sandy through the satellite program. And so what that does is that allows us, not only Pikeville Medical Center, but ARH and other healthcare facilities in the area, to be able to have those, a pipeline of students coming in through the MLT program. So I think that's just one example and we've got some others that we can discuss as well, of what the collaboration has been with Big Sandy. They've been tremendous partners to work with, and it's been a great joy, and there's plenty of other things that we're looking at going forward that we're excited about. But that's just that MLT program was a true success as far as we're concerned.
Thank you. He's only saying that because I picked him up beside the road and I'm his ride home, so he's trying to get some brownie points. I'm just kidding. So this is one of the partnerships that he's talking about, but I want to share just a little bit about our grant and the financial support. Seems like much of today has really talked about the ability to do things with funding. Obviously, we can have ideas, but as they shared, if we can't put legs to that, we can't make that happen. And in case you don't know, nothing is free really today, so we definitely need the funding and the support for that. But ours really stemmed from what we called Pathfinder Health Pipeline grant of about, I think, $250,000, and really had 4 pillars to that. And that really included a very comprehensive approach to making those early connections. And that really included outreach. That really also included engagement, dual credit, growth or expansion, as well as health career awareness. And this was really a focus on reaching back into middle school and somewhat elementary school with some of the materials, and then really strengthening those dual credit partnerships to be able to help students move seamlessly from that high school experience into the college experience. And another key part of that may be of interest to you is really once you make those contacts, how important is it to really stay in touch with those students or those prospective students? And part of that grant really focused on Element 451. It started out proposed as let's do an app, but then we found a communication platform that really helped us to be able to house that data of our prospective students and to really figure out ways to stay in touch with them. Sort of that high touch that students know you weren't just a number that day. We still care about you. We still know where you are, and we want you to be part of our program. And then Leslie, very quickly, not part of that grant, but that I do want to say thank you. I think the CPE also supported another, I kind of call it the bookends, getting more students in the pipeline. I had written a grant for KCTCS, and that was awarded at about $327,000, and that was really focusing on the other end of it. Regardless of how many students you get in the pipeline, what if you don't have enough faculty to teach those students? So I called that the NET program, which was Nurse Educators of Tomorrow, and we have been able to fund up to 20 faculty that are currently in the KCTCS system to go back and finish their master's degree under the support of this grant. So I hope that's helpful to anyone out there, but we have to think about it comprehensively.
Thank you so much, Patsy and James. There's so much going on in Kentucky that we're so proud of. As we heard from Nancy this morning, there are a lot of challenges. We have a lot of work that we have to do moving forward. So it really presents some interesting challenges for our teams. So I want to ask some pointed questions about the structure of a meaningful partnership, and I'm going to actually start on that end first with Patsy and James with you all. So my first question is this: since the key component of our initiatives have hinged on partnerships, let's talk about the evolution of trust between the university or college and the hospital. How has the Healthcare Workforce Collaborative strengthened that trust, and could you elaborate on any fears or vulnerabilities that you might have had as you were building this partnership or before you moved into that?
Yeah, I think one of the things in building a partnership and having that trust is certainly familiarity, and the most important thing, I think, is communication. Having open lines of communication, being able to identify what your needs are, being able to identify as far as what your projected needs are. And that's one of the things that we have are trying to do a better job of. Obviously, with the needs as it relates to our healthcare workforce, it changes. We had a real issue, a real challenge with respiratory therapists. We had an opportunity to work with Big Sandy to work on a tuition assistance program that allowed for us to develop a pipeline that got students into the programs at Big Sandy. And to date, we don't have a problem with filling slots for our respiratory therapists. So we're working on other programs as well to try to do those very same things. But I think the trust, the open communications, trying to share those ideas and thoughts and just having that collaboration and that ongoing collaboration and is paramount to being able to move forward.
I will say, having been in higher education for 30 years, and I've been a nurse for 35 years, so I recently said in a meeting that I was bilingual. I speak healthcare and I speak higher education. And I think that's a good mix, honestly. But having that kind of longevity, particularly in that region, I've had the good fortune of working now with ARH. Many of those were private or under another corporation, but now we're kind of centric to all of our ARH partners as well as PMC, a lot of community partners. So I think the college really has the obligation to serve all of the constituents in our particular service area and beyond. And part of that, I think, is just in the simple word called deliverable. When you come with an idea, I try to map out my idea. I always try to tie money to it. If there's going to be money attached to it, people want to know what this is going to cost. And bring that proposal with who has what responsibility? What do you envision that this is going to look like a year from now, 5 years from now? And what kind of impact can we make if we combine our resources? So I think it is really about coming to the table ready, honest, transparent, and again, really committing that there is a deliverable and we're going to recognize the success together. And should this not be successful, there is no blame game. You know, we work very openly, very honestly with all of the partners that the college has the good fortune of partnering with.
Thank you. Daniel?
Yeah, well, back to the luncheon story. The second day, I arrived on campus. Best nursing chair in the academy, Brooke Bentley, said, "You need to meet Mendy, Blair. You guys are like siblings of energy." So we had lunch, and it was one of those lunches that were about 2 hours long. I mean, just constant talk. And we realized that we have a penchant for emotional intelligence in the workplace and positive psych interventions, and it just took off from there. And I, talked to her about our guiding principles within our college, which is the acronym TOBS, which is trust, optimism, belongingness, and serving others, and how we operationally define those words. And those words are very, very important. And she concurred, and she kind of talked about Baptist One, or One Baptist, and how those themes just totally coincided. And we agreed that let's work the emotional intelligence magic, not only between us, but let's spread it. And we have, and it's been really neat to be able to create a friendship, but also a working relationship where it truly is transparency and trust. And she'll tell me this is not working, or I'll tell her I don't know about that, and it's okay, because in the long run we have TOBS and One Baptist between us. You want to elaborate on that?
Yeah, absolutely. And Patsy, I have to resonate on something you said a while ago. Of course, number one, I'm feeling really old up here. I've been a nurse for 40 years now, and I'm like, oh my gosh, where did it go? But I was teasing at lunch. I said, when I was in high school, I actually had a counselor. We didn't get counseling. I grew up in Eastern Kentucky, and my counseling session in high school as a senior was to sit in my spring semester before I graduated with a lady with hair that's about 10 foot tall and was smoking a cigarette in her office. True, Eastern Kentucky at the time, and asked me what I want to be. I mean, what do I want to be? And I sat there for a second, and I actually love to draw on my past experiences, and I think to myself, what do you want to be your spring semester as a senior? and thank goodness I had my mother that was a nurse, and she guided me in the direction where I apparently loved the profession if I've been in it for 40 years. But I think it's all about, establishing trusting relationships, because I'm telling you, I texted Daniel the other day, and I said, hey, we're seeing a decrease in the amount of students who we're getting over here for our laboratory sciences. We'd love to see more students over this way. We're hurting over here right now. And it's not only nursing, it's everywhere. And I said, we're hurting. And I'm telling you, he was on the text in a hot minute. And he went over to the chair of the program. We met over the Medical Academy Explorers, and we started, looking at opportunities there to kind of help grow this. So it is open communication all the way. I know we have to case manage these folks, and I told Dr. Bentley a while back, I said, because of our great relationship and open communication and being able to pick up the phone and call one another and say, we've got a student that's floundering. She's been over in your area, or he's been over in your area, and let's collaborate for just a second. What is he going to need over in the clinical placement side? What is he going to need in the classroom? Because we don't want anybody to lose out here. We've got somebody that's expressed an interest in healthcare. We're going to try to figure out how we case manage that person through. Same thing with high school students. You can't just let them say, I'm interested in your Medical Explorers Academy, and then they drop off like a blip off the screen. It's got to have strong advocation for that individual and case management of that individual. Those are going to be the future opportunities for us. Believe you me, Daniel, and Dr. Bentley are always saying, how many do we have in there right now? Are they actively progressing through? Did they show up once a month? Because we're all interested. When they graduate, we're going to be grabbing a hold of them, and we're going to point them toward the direction of where their dreams will want to take them as far as healthcare is concerned. So I think trust is extremely important, but like they said, it's all in open communication.
Great. Gwen?
Okay, so building upon your mother's story a little bit. So we got to have another story. So my mom, too, is a nurse, and I will say that recently a nurse that I grew up with that works at UK Healthcare approached me and said, do you know how much your mother impacted my decision to become a nurse? And I watched your mother as we were growing up, and she made the world of difference in my life, and I just want you to know that. So role modeling is very important as we move forward. As far as our partnership and trust, I think that, yes, open communication is really important, being able to share ideas and information. I know that one of the things that we do and partner through UK Healthcare and the College of Nursing is that we actually help fund some of our part-time faculty that teach our clinicals, a lot of them actually. And one of the things is that it's our nurses that are teaching those clinicals, and we really had partnered on what's the best clinical experience and how do we build upon that, because if that student comes into our organization for their clinical and they have a bad experience with us, they're not going to want to come back and work for us. And so that was one place we said, we really have to impact this. So I believe that building out that program and partnering in that way has really enhanced the clinical experiences that people have. I mean, it means a lot when you work in this area. These are my patients and these are my coworkers and I'm here. It really brings that student into that family. And so that has been, I think, instrumental in our partnership. And being able to say sometimes if something's not working out, to say this didn't work as well, that we can share that information back and forth. And Dean Manus knows I call her all the time and say, can I come over and meet with some of your students? Can I have your students to lunch? I want to sit down with some people. I'm trying to figure out if this would work, if that would work. Well, would they like this better? And we have that openness, and she's always willing to go, yeah, Gwen, here's time, and here's some people you might want to talk to. So I just think it's that kind of partnership. And since COVID, I think has made it even more real because we've had to be flexible, and we've had to be able to just say, okay, we did it this way last year. That didn't work very well. So ditch that idea and let's move on to idea 2. And you have to be able to be nimble and do that. So I think that's something that's important about our partnership.
So since we're confessing about our parents, and I think I've told our Dean of Nursing this, I am the product of 2 nurses myself. So, and I went rogue. I went into public health. Yeah, so I'll just add one thing that's maybe a little different than what we've heard, and that is at UK, in the Provost office, we do require that each of our colleges that are looking into new degree programs create either a 5 or 10-year pro forma and account for all of the inputs and the projected revenue from the program, such that we want to see that these programs are going to be financially sustainable. And what that may mean at times is that if we're approached by someone in healthcare to take on a new degree program and the projected enrollment is expected to be low, we may not be able to take on that degree program. So getting back to your question, Leslie, I think transparency, which we've heard from several panelists, is important, and articulating the expectations of the institution, to take on new degree programs, I think is also important.
Thank you. We talk a lot about innovation with regards to building this strong healthcare workforce. I think innovation is critical because there's so many caveats that you have to consider when you're looking at strategic actions. Can you speak about some of the innovative approaches that you have successfully used that's helped create a robust healthcare workforce for your region? You can start, Katie and Gwen.
So one of the things that we did through our partnership is we are a magnet designated organization, and we all know that is the gold standard of nursing excellence. But part of that process is that it helps with your retention and your recruitment of your staff, because we know, and it's very clear in the literature, that if you're magnet designated, your nurses are more engaged in the work, and you have better patient outcomes overall. And so part of that application process, improving that you are performing at that gold standard, is that you need to be able to show scholarly work, and you need to be able to disseminate that scholarly work. And we knew throughout our organization we had many frontline staff that were engaged in evidence-based practices and ensuring that we were improving outcomes for our patients, but we weren't capturing that work as well. So through this partnership, we created some joint faculty positions where healthcare funds part of the position, and a percentage of that faculty's time is spent with our frontline teams. We have one embedded in our trauma program, one in cardiovascular. We have one now with our Barnstable-Brown diabetes. So we have several of these nurse scientist roles. And what they do is that they engage with the nursing practice councils in each of those areas so that they can help them and guide them and show them how to build out this project, how to get into the literature and see what are the best practices, and then how to implement a project, how to capture that, and then they help them put that together, whether it be a poster presentation or a podium presentation, and then they speak regionally and nationally with the frontline staff. And so that really helps them build our application for our magnet designation. So it's a way that really builds the professional development. So many of those staff that are engaged in that work then are some of our people that are then applying to the PhD programs and the DNP programs and become our advanced practice providers of the future as well. So it's that building block that I think has been very innovative in our approach.
Well, I think we can talk about two programs that first come to mind. In the first program that we incorporated at EKU, we developed our Learning Center into a Center for RPG, which stands for Retention, Progression, and Graduation. And, of course, the term retention is always important, but what we're also finding is if we don't pay attention to the progression from sophomore to senior year, a lot of students are lost as well. And so we've developed somewhat of an innovative program called Organizational Studies, where rising juniors and some rising seniors stay on campus and at the end of spring semester in May, and they get to go and learn from and about different organizations, not only across the state, but across the country, from going to different hospitals to going to the CDC and so forth, so that not only can they learn what's out there regarding possibilities, but those organizations also give them real-world applied problems that they have to actually solve in groups, which is a fantastic experience, I think. Another innovative program that we brought from Georgia is the Harvard National Undergraduate Research Conference. And so the college funds 10 to 12 health science undergraduate students to present their research in poster fashion at Harvard's undergraduate research conference. And it's a pretty cool experience because this past year we had students who had never been on a plane, never been out of Kentucky, and there they are presenting at Harvard University. And it's pretty special to see them shine a little bit.
Always makes me smile when I listen to a colleague next to me that kind of repeats a lot of things that we're thinking about along the way, so we're not too far off, right? when we're trying to think of really creative ways to engage the workforce and be innovative at the same time. Somebody said in the first panel, I loved it when they were talking about meet the employee in the middle, the person coming out that may have a different idea of the way the workflow looks. I think that's extremely important because I'm telling you, I have had to stay young and nimble as it can be, because after 40 years of healthcare, I could just sit there and tell you with my eyes closed, this is the way it gets done. But the challenges now, I tell you, I think, you can't get by with one conference without saying the word COVID a couple of times. But I'll say COVID did do something for us. It made us shake rust off of us for a few minutes and think about how we were going to do things differently. I loved Gwen's approach, and we do something very similar. When you've got students with you, what we've done, especially capitalizing on any student gets placed at Baptist Richmond, they are a part of the innovative team. And when they're thinking, we're challenging them at the very first day of their first clinical. I meet with every clinical group that comes into that hospital, and I drive my administrative assistant to drink because there are lots of clinical groups that come in while she's trying to coordinate my schedule. But she looks at those, I meet with them intentionally, and I tell them, you know what, that experience, you make that experience what it is, and we have a relationship and responsibility to do the same for you. So it's a 50-50 relationship, ask good questions. We just had a student that just approached me and sent an email to me, and I love when I get an email from a student that has an innovative idea that took my challenge on and said, you know what, I would like to go ahead and help advance practice. And I saw something at another clinical location where they're doing it this way, and this way. And I went out and looked at the literature, and I think we've got some opportunities here at this hospital. And I'm thinking, wow, okay? Because everybody working in healthcare together is what makes it work for betterment of outcomes for patients. So I went ahead and took an individual and assigned. She went up and worked with this the student nurse, and we've got a project going right now to transition some care items over. We're looking at our products that we're bringing in so that we can reduce the suffering for patients and be a little bit more efficient in the way we're doing it. So I always tell the students when we meet with them, you're going to bring things that you're learning in your classroom that are pretty more innovative and up in line with what the evidence says now, or you're going to see things out on the floor that are going to be incongruent with what your thoughts were because you were in the classroom and learned it one way, but we're already ahead. I said, but we're all partners in this together. So the innovation is bringing them in, getting them started early, getting them on projects, and then we have them showcase.
One of the challenges that we have in Eastern Kentucky is that the coal industry obviously was the big part of the economy that drove the economy in Eastern Kentucky, and now that's not the case. And all too often what we find is that we find the young people are leaving our area, leaving our region. So what we've tried to do to be a little more innovative is that we've started in March. We have the Workforce Innovation Center there at Pikeville Medical Center. And so what we've done is we've developed a comprehensive program, and it's a K through 12, and I think Dr. Thompson talked a little bit about that this morning. But we've developed a K through 12 program that is grade specific, that allows each grade level to have an experience, and our philosophy is we've got to hit them early and we have to hit them often. And we have to teach these kids and expose these young people to the fact that there are good paying jobs in Eastern Kentucky. You can stay home, you can go to school here in Eastern Kentucky, and you can get a very good paying job right here at home. You don't have to leave. So one of our objectives is that we have tried to work with, and we've had a tremendous relationship also with our school district. And so we work with them in trying to promote and provide programs for these students. One of the programs that we have is and this is for the 10th graders. Our goal was to have every 10th grade student in Pike County attend one of our career spotlights. These career spotlights, what we do is we set up a table, and we set up 13 to 14 different tables throughout the area, and each one of those tables represent a different career, a healthcare career. And so our goal is to have every sophomore go through and experience and be exposed to what the various careers are. And we also talk about money. We talk to them about the fact that, look, you can go and get an associate's degree, and after 2 years, you can be making $60,000 a year. And so we want to make sure that they understand that they're knowledgeable, that they understand that there are opportunities. As a matter of fact, after one of our career spotlights, we had a parent call us and said, hey, my son just went through your career spotlight, and now he wants to be a rad tech. Can you help? So we helped develop an academic path to help him so he can obtain his career goal and to go to school here and stay here and work here. So that's just one of the things that we're doing. Again, we've got a medical academy similar to the Medical Explorers. I was in a Medical Explorer post in high school too. But we have a medical academy where we have these 24 students, and it's application-based. So these students apply for this position, and they come in and they get to see a surgery, see a heart cath, they get to go inpatient rehab. All of these things that we want to expose these young people to the careers, get them excited, because if we don't get them excited and we don't start early, then we're not going to capture them, and we'll lose our greatest resource, and our greatest resource in Eastern Kentucky is our young people.
Thank you. Every time I attend a conference or a workshop, I like to come away with something I can actually use. You know, a lot of times we talk about general things, but I have a very specific innovation that I want to share here today that I think is going to be an amazing impact on not only recruitment for nursing students into the pipeline, but also for retention of nursing students. And how many of you in here have ever worked with nursing students or healthcare students? I feel like I'm going into teacher mode. I need to stand up. But do you hear barriers that students have? Do you hear students complain about either academic barrier or non-academic barrier? I can't afford that, and you're shaking your head. I have time obligation. I can't participate in that because I have to go to work or do something else. And one of the things I think, other than just the skill of teaching, is I've learned to listen over 30 years very intently to students, and more importantly, to not just sit there on that information, but to take that information and do something with it. My boss is here, she can tell you, I mean, I'm not constantly, I have an idea. And she closes the door, I have a meeting, to close me out in some way. But this is one I think that people bought into very early, and I'm glad, because it has the potential to not have students simply pay for education, but to get paid to go to school. So many of you have probably worked with apprentice students or externships or internships in some way. But I often heard students say, I have to work another job, or I can't really do all your clinical time, and I can't do that as well. So I took all of those things into consideration in creating this initiative, along with the program advisory boards that are really representative of business and industry that support our program in some way. And what we created was called Extern 360. So we took a traditional extern model, and 360 for me is because it comes full circle. We actually reached out to the Scholar House, which is more of a philanthropic type support for our students, reached out to our clinical partners. ARH, I think, will be jumping on in the spring, and worked with PMC this semester. Any nonprofit can help us with this. And we actually turned an externship experience into sort of an academic shared extern experience. And I think it's probably the only model around where students can actually get clinical credit for going out into the hospital and working as an extern. So it's not only getting paid to go to school for lab time, clinical time, classroom time, but also the externship. It keeps students from working in things that are not really connected to their discipline. We wanted that to be more focused. And then the students, of course, earn $12 an hour for all of that. So students are now telling me, hey, I'm getting paid to go to school. So now they're really interested in continuing to go to school. Then they end up with about $9,000 toward a BSN transfer degree or any other educational expense that they want through this program. And basically, it is just really an accountability model for the student to say, I'm not just an extern and I can go when I want to. It's really bringing the student into that professional dimension to say, I'm a professional and I have a commitment to this hospital or this organization. So I show up on time, I dress like I'm supposed to, I have that social and professional etiquette while I'm at work. So it's really like not only training in the skill set, it's really training somebody as a professional. So I'm really excited. We're actually launching this week. The students are in the orientation. They will be placed with what I call staff nurse educators, and that's basically like a pool of preceptors that have been onboarded as faculty. So at a 3-to-1 ratio, every 3 hours that the student is successful in an externship experience, they get an hour off of their clinical obligation with me. So if they do 90 hours, then it's 30 hours off of their clinical obligations. So the students are like, woohoo, I'm going to get paid to not go with Dr. Jackson. Let's try that. So again, I think the model is going to be an amazing way forward to actually help students remove some of those barriers that actually obstruct them from being successful, to really build stronger partnerships with our nonprofits in the area. And the other end of that is to build that BSN transfer, because I don't want them to simply stop. I want them to understand that it is endless what they can do in nursing and in the healthcare industry. And again, we're just there to kind of wrap the student up and address as many of those barriers and obstacles as we can in one fell swoop. And I think we're going to succeed in that, and we'll be happy to replicate and share that when we finish rolling it out and have some data to share with you.
Y'all mentioned barriers. Can you reflect on barriers that your organizations encountered while working with these collaborative projects? And if you can, how'd you navigate those? I'll start back down there at the end and work our way up.
I think one of the barriers that we see as a hospital is the fact that we have a need. When we identify a need for a certain position within the hospital, and maybe it's a degree program that the community college does not have, or the college system doesn't have. And so our need is, we got to fill those positions today. And so I think one of the challenges that we have as far as a healthcare facility is concerned is to be patient, to work with our post-secondary partners, to try to be creative, to try to come up with ways, because we understand the accreditation program to do a new program is lengthy and difficult and challenging. That's why when I mentioned earlier on about the MLT program, that we collaborated and we became a satellite program off of the JCTCS. So what that did is that it expedited the process and gave us an opportunity to do that. And I might also add that we're so successful with that program, we're also looking at surge tech and radiography as well to do that. So those are two programs that we hope to develop yet more satellite programs, because we understand that, because we are small, relatively speaking, as far as the number of students that maybe need to graduate from those programs, that it may not be cost effective. But if the KCTCS system can kind of share resources and share programs and do those satellite programs like that, then it benefits not only us, but the post-secondary partners as well.
Yeah, and I don't have really a lot to add to that, other than I think the learning space has been a little bit of a barrier, but nothing like a good challenge or barrier to bring you to the table to figure out what the solution would be for that. So clinical space, obviously, especially in hospitals perhaps that are not as large, or in sites that are not as large, might be a little bit of a barrier. If we grow and explode these programs, where do they actually receive their clinical education? And I can say with our local partners, we have a very open dialogue about that, and put systems in place where we can actually sit down, talk together, bring all of the different colleges and learning environments together to see how we can better utilize that space and be complementary to each other, not necessarily competitive all the time.
Daniel?
One program that Mendy and I are really passionate about is bringing the blue zones to Madison County. And we're so excited about it, and we've developed it. It makes sense. The framework is solid. Economic development. I mean, there's so many goals. In fact, I actually called Dan Buettner, the author of the Blue Zones. No offense, Kentucky, but we wanted to call it the Maroon Zone instead of the Blue Zone project of Madison County. And we had the proposal. In fact, I think we found money even, but we ran into the hurdle of local government. And so one of the aspects that we're still working on, we haven't given up, is just to kind of navigate, the Chamber of Commerce between Richmond and Berea. And hopefully, as we find more time to get in front of them, they'll see the positives of the Blue Zone.
Yeah, if you've ever driven down the 87 Eastern Bypass, that is Heart Attack Alley, all the way to our hospital. And blue zone doesn't sound like it takes on much of a ring when you're talking about healthy. But at the same point in time, it's just like what we're talking about with anything. You have to know who the players are, having the water cooler talk, having the grassroots level discussions, getting in there and really kind of working what you think your passion and your vision is going to be. The other thing I'm going to say is, and I'm going to resonate on something that Patsy said, space, space, space. It's space. If EKU came to me, I'm telling you, I'm trying to be the most innovative individual in the world to place all of these students. We've got them working 3A to 3P, midnight to whenever. I mean, they are coming in. The academic facilities are doing all they can as they get their students to make that flexibility happen to where we can get as many students as we can to get those experiences in, but then trying to find the space for it. And if you're a constrained rural community, small community hospital, it's very difficult to find those spaces. I feel bad when I see them all huddling around in the cafeteria trying to have a conference discussion about patient care. So it's just that constant challenge. The other thing I'm going to say about barriers, and I guess I'm going to take a bully pulpit here for just a second. I'm going to say I come from the belief and the philosophy that if you want to get in healthcare, you better be wanting to take care of people. And so somewhere along the way, the barrier is there's that fine balance with the competing priorities of young folks seeing dollar figures in their face and seeing that, you know what, this is job security, good benefits and everything, but trying to find those individuals that are committed to healthcare, committed to taking care of people, committed to go ahead and say, you know what, I'm in it, and I'm in it all the way because I'm a compassionate person that cares about individuals and cares about seeing them, whether it is to help with their outcomes and improve their quality of life, or if you're going to help them with a quality death. Either way, we've got to have more compassion at the bedside somewhere along the way. And you know what? I had a conversation, a lovely one at lunch, and it was someone from KCTCS, and I loved it because she said, you know what? We get in with those students pretty early, and we talk to them. She goes, I kind of feel weird, like I'm trying to talk them out of healthcare. And I said, that's the same way I feel sometimes when I'm meeting with the clinical groups. I'm letting them know right away when I'm looking at them. I say, we're looking for the best of the best, the compassionate, the smart, the savvy, the innovative, the ones that are looking for a job, of course, but at the same, and really want to be in it to win it as far as facing all of our complexities in healthcare. But I'm also looking for that person that's compassionate at the bedside too. So that's sometimes a barrier whenever they're hearing all these competing things and they're here all the time.
So big blue zone sounds good. Sounds like a football, something related to football. No, I think that's great. So it's always easy to identify challenges, right? It's harder to identify solutions. At the University of Kentucky, we have a robust shared governance system. And so we can't, create a new degree program. It has to come from the faculty. They have to want that degree program. And then I don't know if Melissa's in here or not, but start to finish a new degree program at UK, you're looking at least a year, if not 18 months. And so, Leslie and Aaron hosted a great meeting last night with a bunch of the hospital CEOs, and it was such a good forum for us to hear from them, but for them to hear from us as well. We talked about the challenges of recruiting faculty, especially nursing faculty. I've learned a lot in the last 2 years about the challenges of hiring nursing faculty, and so we are brainstorming different mechanisms that we might be able to leverage to bring those faculty in, but we can't grow those degree programs unless we hire additional faculty. So I would say those are a couple of our big barriers.
So I would say a couple of things that are maybe not barriers, but challenges. They're just a reality, and part of that's, I think many people experience this, but at the University of Kentucky, we get a lot of out-of-state students, people that want to come to school at UK that live out of state. And I know earlier somebody mentioned this, that many of those students don't want to really stay here and work then. And so that is a challenge. It's a reality. I don't have any great solutions for that, but it does break my heart. And I try to think of, I'm like, I'm okay if they want to go back to Eastern Kentucky and work. And that's good, right? That's okay, and I want that. But when they want to go, back to a different state, that's a struggle for me. I think one of the other things, and kind of to Mendy's point about what people want when they get into healthcare, and I think it's just a very it's a different generation. They have different expectations. And both in their learning environment, I feel confident the colleges are seeing this, but we also see it in the workforce. Like, what does a flexible schedule mean to them? Like, I can tell you, I got on call, I got pool. I think I got flexibility like crazy, and they're looking at me like, that is not what I want. And I'm like, okay, so, those again are those dialogues and focus groups of what does this mean to you? And how do I then develop that and make that happen within our workforce? And also, I think they've seen a lot and heard a lot about workplace violence. I know that has come up multiple times. I think Mendy can say this. I too have been a nurse for a really long time. I've been at UK for 31 years. And I can tell you, when I was taking care of patients at the bedside, I did not experience on a regular basis what our staff experience every day. And it is overwhelming. And that is something we have to we have to help with. That's our job. It's our job to keep our patients safe and our staff safe. But we also have to prepare our future healthcare workers. And how do we have those conversations? And how do we help them? And how do we best make sure that we're giving them well-being and mental health support as they come out and join our workforce? So I think those are just challenges that we have that we need to be thinking about and be creative and innovative in those solutions. Again, I don't have the answers, but it's on my mind, and it's one of those things that keeps me up at night.
Katie mentioned our advisory group that meets. That group was established a year ago to execute the healthcare workforce collaborative dollars that the General Assembly entrusted us with. So we talk a lot about barriers in there, and we try to generate solutions. But today's focus is really on success. So success breeds success. After we're successful with something, then we generally go on to something else. Would you guys talk a little bit about some of the future things that you want to be involved with?
Sure. So I mentioned at the beginning of the session that our Provost is also now the co-CEO of UK Healthcare. And he, I know he wanted to be here today. He's at an accreditation meeting, but he has quite a creative mind. So I'm certain that I don't know the extent to which I'm looking around the room that we're going to continue these efforts. I know that he is committed, as I said earlier, to better aligning the healthcare enterprise with our academic colleges. He's also committed to bringing to bear our research enterprise. And he is, for the first time, inviting our Vice President for Research to the table at UK Healthcare leadership meetings, along with our academic colleges. So I'm optimistic that will bring to bear additional success on the research side as well. I was excited to hear a lot about AI in healthcare today. That's something that's definitely on our minds. Our provost is also convening the healthcare deans together. He's big on transdisciplinary approaches to education. And so this is something that he is trying to do, is spur greater collaboration between our healthcare colleges and our non-healthcare colleges, for that matter. And then I mentioned earlier, but we are using our CPE funds, funding several market feasibility studies. I mentioned audiology as one example. We're looking at other examples as well, of potential new degree programs or expansion of degree programs. And so I would hope that in the next few months we would know the answers to some of those questions. But this is a space that we, and I put myself in here too as a public health scientist, we are very excited about this space. We're very excited to see the focus by the General Assembly on this and a focus from CPE.
So first off, I'm going to steal shamelessly from Mendy, and I'm going to meet with all the clinical groups as they come their first day. So I'm going to steal that. I love that. So the other thing I think that we're really trying to think about, and you saw the statistics at the beginning of our day about areas where we have great vacancies and we're having trouble. And so, yes, the emergency department and the ICUs. But again, those are some pretty hot areas, and people like them, and we tend to be able to recruit there. But our acute and progressive medical surgical areas are areas we're struggling and continue to struggle. So we're really trying to sit back down and rethink, what do we do? How do we really, and that's a great foundation for nursing. A few years ago, we kind of, some of our scholarship students, we placed them in those areas, and they were so not happy with us. But I had several of them approach me, and we asked them just to work 1 year in that area. And several of them came to me and said, I did my year, and now I'm transferring to the ICU, and I can't tell you what a difference this has made. I feel so prepared now to orient in the ICU and to be in the ICU. And I was upset about that, but I appreciate that. So we're going to have to sit down and think outside the box of, number one, what's their clinical experience like when they're in those areas? How can we make that a better clinical experience to really show them and help them understand the skill set that they can build, especially when they want that career path to be in the ICU, because then they want to be a CRNA, right? So how can we show the importance of building that basic foundation and skill set and what that will mean to them later in their career? And gone are the days that I'm expecting anybody to be at UK Healthcare for 31 years, because that's just not what people do now. And that's okay, but we need to also equip and develop our managers to be those frontline people having those conversations. So when my new nurse starts today, okay, tell me, where is it you want to be in 5 years? So when that person says, yeah, I want to be in CRNA school, or I want to be a midwife, or I want to be okay, then let's talk about how we help you build that career path, because we want that career path for you to stay here as part of our UK Healthcare family, but let me help you develop that. So I think we have a lot that we need to work with our frontline managers and supervisors to help them have those conversations and not be afraid of those conversations, but instead embrace them, and let's help people develop professionally, which I think we will only reap the benefits, and the Commonwealth, the people of the Commonwealth will reap those benefits.
Yeah, post-pandemic Gen Z is an interesting generation. We've done a lot of focus groups and asking them, about their experiences of what they want and so forth. And some of the glaring themes are, of course, applied international experiences, caring, faculty, and positivity, right? It's kind of what's been coming out of the groups that we've been talking to. And again, one of the best chairs in the academy, Brooke Bentley, has single-handedly kind of changed the culture of our nursing department, and she's developed an acronym called Nursing Cares, EKU Nursing Cares, and each letter represents a notion of empathy and care. And you can just see, since she's implemented it, the difference in faculty and student relationships. It's pretty powerful. And within the CARES program, there is a specific program for mental health with our nursing students. The stress of what's happening nowadays on campuses is immense, and to have those interventions from a mental health perspective is very, very important. And Brooke has kind of taken the lead on making sure that those programs have truly come into an existence. The second program, and we talk about healthcare, but there's so many different types of healthcare, and I'm a big fan of recreation, and so we've developed DCORTI, which is the Eastern Kentucky Outdoor Recreation and Tourism Initiative, just kind of stealing the page of West Virginia and the multi-billion dollars that they've incorporated into their economy through outdoor recreation. And so we're very excited about this, to go into Eastern Kentucky and Appalachia and really teach the importance of recreation, which is very, very exciting to see some of the grants come to the table regarding UCORDI. And last but not least, we just returned from Poland. Each department is going to have a transcultural philanthropy experience. So nursing is talking about going to Africa and really helping with HIV prevention. The exercise and sports science clan, I went over to Warsaw with them, and we put on a 3-day sports science clinic for athletes and coaches to learn a little bit more about their body and how to experience optimal performance. And then each department will have that. But just to see the students grow in Poland, they were able to go to Auschwitz and go to the World War II museums and just see some of the transcultural stuff. But then also, on the other hand, truly helping youth and young adults in regards to athletics was pretty special. So those are 3 that we're thinking about.
Yeah, and I have to echo what you said in terms of mental health. We all know that is an imperative. Baptist Richmond just opened up an 11-bed inpatient psych unit called the Thrive Center, and we're thrilled to death to have that thing up and running. It's a great need there in Madison County and some of the surrounding counties. I'm looking for excitement and opportunity in working with the School of Nursing to open up a lot of those clinical opportunities for some of those psych NPs to come on through. Other things that I think EKU, as a great partner, has done with us is they have advisory board meetings, much like most academic facilities do, where they ask our opinions in practice of what our needs are. I think our colleagues down here inferred that as well. And I think that's great in that, what Gwen said about workplace safety and workplace violence, I too never experienced that like it gets experienced now on a daily basis when we have conversations during our safety meetings. Our safety meetings used to be to cover patient safety items in the next 24 hours and the past 24 hours. Now it is also including safety of our own employees. So it's a different world, and so I'm looking more forward to opportunities to collaborate there. I was sitting there while he was in Poland. I was in Europe last week, the same time, different places. And the one thing I think is an opportunity for all of us in healthcare and in the academic institutions as well, I was amazed at what I saw. I was at Pompeii, and before I went in for the excursion, there was a individual behind me that tripped on the curb, and she face planted. Her whole entire face, her hands were full, and she fell on her face as in my tour group. And I turned around. My friend that was with me screamed my name because she knows I'm a nurse. And I turned around, and she had knocked herself out. And she had literally so many lacerations across her face, and she was unconscious. And there was a phenomenal, and I wish I knew his name, the phenomenal police officer from the UK that was in our group. And there was a retired trauma surgeon in our group. And we all went to work, and it was a beautiful moment. She ended up coming to after a few minutes. It kind of scared us. And we had her stabilized to where the Italian police and the ambulance all came. And my point being there, I watched the synergistic effect of every discipline there was. And I'm telling you, that police officer, I told him he needs to go back to medical school. We'll put him over at Baptist Richmond. He was phenomenal. But my point being is I think we have, yes, success breeds success, and I love that, is the opportunities that lie before us for that interdisciplinary care. We've been talking 40 years worth in healthcare. Oh, we do interdisciplinary care. But you know what? I've been talking about nurse up here. You've been talking about nurse. But I'm telling you, everybody on the team, and I'm telling you some amazing things that can take place if we have the space to do it. I went one time to a college that had carved out a huge space down in Florida, and they had a half of an ambulance pulled in there, and they had clinicals where they actually would have everybody learn together as a community group on how to take care of that patient and what expertise and what every discipline was going to bring to that person at that moment. And I think that's where we've got to come. We talk about it a lot, and we kind of put what you call lipstick on a pig every once in a while, but I think we've got some great opportunities in that area, because if we can get everybody around there, it's phenomenal what that patient's going to end up incurring as far as outcomes.
Well, as we continue to focus our K through 12 initiatives and then post-secondary initiatives with regard to our students are concerned, we're also focused, and we're wanting to focus even more on trying to work with our employees. Again, our employees that we have in the hospital system, they're excited about the careers that they're currently in, but they may feel stifled. They may be an LPN and they decide they wanted to make a little more money. They want to better themselves and their families. So what we do is, through our Workforce Innovation Center, is we work with our employees and we have a counselor. And those employees can contact this counselor at any time and talk about an academic path. What sort of academic path can they take to enhance their professional career? And so what we do, again, in collaboration with the community, with Big Sandy, as well as UPike and Gayland and ANU, what we do is that we have tuition assistance programs. So we offer our employees an opportunity to go back to school. We'll work with them on their schedules. We offer a tuition assistance program, and we help work with them on an academic pathway so that they can move forward. One of the other things that we're looking at, we're working on, and just kind of the tip of the iceberg right now, we feel like that this is a tremendous opportunity for us, is internships. We're working very closely with UPike on internship program. We've reached out to Big Sandy as well to talk about working with them. When we did a survey with our senior leadership as to how many departments would like interns within their departments, had an overwhelming request for interns within the department. So again, another opportunity for us to be able to get these young people that are in the college system to have exposure to the healthcare system, and then we can translate those individuals into employees that will be long-term employees that will certainly benefit the overall healthcare of our area and of our region.
I realize I'm between you and getting out of here, so I'm going to be quick. And I would just say in general, obviously we are on the track for many successes, but I think part of that just in general is, one, we're going to have to be more efficient and effective and accountable. I do think the legislature definitely wants return on investment. They want to see that the money they're investing is being spent wisely and it's producing a meaningful outcome. So I think that is something that not only from private industry but also from higher education. The other thing is, I hope really moving forward that we can expedite the process, that we're not a barrier in higher education to say it takes us a year and a half to respond to your need. I definitely think we have a commitment to be a little more rapidly responsive to business and industry, so I definitely hope that we can do that. And lastly, I would share that I hope that we eliminate the territorial school of thought and we really start looking at things as a region. You know, there may be resources in another place that I don't have, and I may have something they don't have, but together we all have it. So I think removal of that regional, that individual barrier to more of a regional approach is going to be essential for us to survive and be successful moving forward.
Thank you all so much for that. I will say that it's not, you weren't the only thing standing beside everybody and going home, because we have a wonderful reception that we have planned for everyone. Dr. Thompson, would you join us as these folks exit off the stage, and we will enjoy some parting comments.